To begin the sub-Q injection, I'm going to start by gathering my supplies. I have an insulin needle with medication in it, and I have my alcohol pad. If I were giving any other medication, then of course I would select the appropriate syringe, needle, and medication, as well as the dose, observing the rights of medication administration. So I have my supplies gathered. I'm going to enter the patient's room. Knock, knock. Hi, Mr. Malo. How are you doing today? That's awesome. My name is Emily. I'm going to be your student nurse for this evening. Could I just get you to state your full name and date of birth? And also I'm going to check your little armband. Is that okay? All right, awesome. So I'm just going to check the barcode right here. Perfect. And the name matches up. That's awesome. So like I said, I'm just here to give you your insulin. I know. I'm going to stick you again. All right. So to begin this process, I have gone through all of those. I'm going to wash my hands and then put on clean gloves. And then I'm going to choose where I'm going to inject. So I'm going to stick you right here, Mr. Malo. We can inject on like the fatty part of the arm, on the abdomen, like kind of below the umbilicus, kind of where you have that fatty tissue. We can get the thighs if we can pinch enough up. That's a good place for self-administration. And you could also use, like, get the patient to roll their shoulders back, and you could use the skin that comes up from the scapula, any place where you can pinch up a good amount of tissue. For my patient, Mr. Malo, we are going to get his abdomen. If I could pinch up 2 inches of tissue, then we would be using a 1-inch length needle, and we would be inserting at a 90-degree angle. But since we can barely push up a single inch, if that, then we already have our needle selected, but we would use a 5/8 needle, and we are going to be going in at a 45-degree angle. So I already washed my hands and I put on gloves. I'm going to clean the site. Then I'm going to allow that to completely dry. It's been 30 seconds. It's dried. I would either use the prep pad to mark the place, or I'm just going to keep a note of where I put it by like a freckle or just some kind of note in my head. But so now that the alcohol has dried, I'm going to uncap my needle. I'm going to pinch up skin, hold it, insert my needle at a 45, that is a 45-degree angle, and inject my medication without aspirating. I'm going to pull it out, activate the safety. I'm just going to leave that there for a moment. I'm going to put a Band-Aid over it, and then I'm going to document the medication, the dose, the route, and the location of the injection. And I'm going to document the patient's tolerance, how Mr. Malo took it, and if there's any kind of education that I provided for him or his family. And then that completes my skill.